All right, now to the healthcare economy, where it's a mad scramble on Capitol Hill to get a new healthcare plan passed. But the parties are sharply split on what that plan should be. Senate Minority Leader Chuck Schumer claiming today the Democrat plan is the only viable way forward.
With just days left on the clock, the clearest, cleanest, easiest, and best path left is to bill what Democrats are proposing: a clean extension of current tax credits. That's it. No poison pills, no gimmicks, just relief. Democrats are fighting for lower health care costs for the American people. Republicans are fighting with each other.
But our next guest has a plan of his own that appears to have support from President Trump. Let's bring in Louisiana Republican Bill Cassidy, chair of the Senate Health Committee. Senator, good to have you with us. I want to put up on the screen here some just broad details of the competing plans here. The Republicans are proposing on the Obamacare enhanced tax credits to eliminate them and take that money and put it into health savings accounts for ACA bronze level plans. Benefit would be, depending on your income level, anywhere between $1,000 and $1,500. You claim that it would reduce premiums as well by 11%. The Democrats simply want to extend the enhanced tax credits for 3 years. They want to give money to the insurance companies. You want to put money into the pockets of consumers, correct?
Absolutely, John. And let me just correct just a little bit. We do lower premiums by 11%. The Congressional Budget Office has scored that. We do take the money that would go to the insurance company and we give it to the patient. And if you're, say, a couple over 50 and you've got two 19-year-old children, then you end up with $5,000 because it's per person in that health savings account. Republicans want to put money in your pocket to pay the insurance policy out of pocket. Contrast that with what Chuck says is the cat's meow. They want to force us to buy a policy with a $6,000 deductible. I'm a doctor. John, most people cannot afford a $6,000 deductible. And they'll say, Doc, I can't get the test because I don't have the money for my deductible. Yeah. That's reality. That's where people live, and Republicans are addressing that.
You know, $6,000 deductible is pretty good compared to some plans that I've seen on the exchange where the deductible is $10,000, even $15,000. But the Democrats insist that your plan is not the right one. Listen to what Senator Ron Wyden said.
The insurance offerings in the Republican bill are snake oil. They will spark a new avalanche of junk insurance plans where insurance companies make out like bandits. The Republican plan's going to leave millions of people, in my view, racked with poverty.
What do you say to Senator Wyden?
Yeah, so the plan he's calling a junk plan is an Obamacare exchange plan, a plan that he voted for. And the reason he might call it a junk plan is because it has a big deductible. What he's promoting has a $6,000 deductible. We instead take money, we put it into account, and when your daughter needs a medicine because she has an earache, it pays for that medicine. When your son goes to urgent care because he has a sprained ankle, it pays for that visit. You eventually enter your deductible. Most Americans never will. We are trying to take the plan on Obamacare that he's calling junk and make it work for the American people by putting money in their pocket, not so that they can pay the insurance policy out of pocket. He should be for that.
So the Republicans will try to kill Obamacare to put something else in its place. The closest you came was 2017, when you almost did it, with the exception that Senators Murkowski, Collins, and McCain all voted against that. But since then, I haven't seen anything from the Republican Party that really resembles a viable plan to replace Obamacare. What do you got in mind?
Yeah, so Republicans have been working to lower the health care cost. For example, the No Surprises Act, which I authored and had bipartisan support, has prevented 1 million surprise medical billings per year. Yeah. In that bill, there was price transparency. Price transparency giving power to the patient, not profit to the insurance company. And so with price transparency, if you can get an x-ray for $50 here and $500 there, you should know that. We have been putting that in progressively, trying to address the problem of affordability for the American consumer. And by the way, did I tell you the plan we're promoting would reduce premiums by 11% and put money in the consumer's pocket to pay their insurance policy out of pocket?
Well, there's no question that the No Surprises Act has been a boon for a lot of people, but there's still outrageous costs in the healthcare system. I remember taking my son to the emergency room once because he got hit in the eye with a ball. They put a drop in it, looked at it through a magnifying glass with ultraviolet light, and they charged us $2,500. I mean, come on.
Yeah, I agree with that. Healthcare costs are out of control. What the Democrats are doing does nothing to control that. Republicans, giving somebody a health savings account gives them an incentive to shop for the best deal, and studies show that works. The mama, she will take care of her money in that health savings account. That forces competition, that lowers cost.
All right, Senator, we'll see. We await the results of the vote tomorrow and see where we go from here. Thank you for joining us. Appreciate it.
Thank you, John.
Hi, everyone. I'm Brian Kilmeade. I want you to do me a favor. I want you to click to subscribe to the Fox News YouTube page. This is the only way that I know for sure that you're not going to miss any great commentary, any great news bites, any great interviews coming your way on Fox. You can get it all here on YouTube. So subscribe right now.